Children's aspirin tablet, Chewable, is used to reduce fever and relieve mild to moderate pain from muscle aches, toothaches, common cold, and headaches. It may also be used to reduce pain and swelling in conditions such as arthritis. Aspirin works by blocking a certain natural substance in your body to reduce pain and swelling. It is important to consult your doctor before giving this drug to a child younger than 12 years. It is also important to keep this and all medication out of the reach of children, as aspirin is a common cause of poisoning in children. Your doctor may direct you to give a low dose of aspirin to the child to prevent blood clots, which reduces the risk of stroke and heart attack. If the child has recently had surgery on clogged arteries, the doctor may direct you to use aspirin in low doses as a blood thinner to prevent blood clots. Aspirin prevents blood clots by stopping certain blood cells, platelets, from clumping together. It is best to consult a doctor to determine the appropriate dosage and the best timing to administer this medication. When taking children's aspirin tablet, Chewable, for self-treatment, it's important to follow the directions on the product package. If you have any questions, make sure to ask your doctor or pharmacist. If your doctor has prescribed this medication, be sure to take it exactly as directed. Before swallowing, make sure to chew the tablet thoroughly. If you experience stomach upset while taking this medication, you can take it with food or milk. The dosage and length of treatment will be based on your medical condition and how you respond to the treatment. Be sure to read the product label for recommendations on how many tablets you can take in a 24-hour period and how long you can self-treat before seeking medical advice. If you are taking this medication for self-treatment of a headache, seek medical help right away if you have trouble speaking, weakness on one side of the body, or sudden vision changes. It's important to consult a doctor or pharmacist before using this drug if you have headaches caused by head injury, coughing, or bending, or if you have a headache with severe or ongoing vomiting, fever, and stiff neck. If you are taking this medication as needed, remember that it works best if used at the first signs of pain. Do not wait until the pain has worsened, as the medicine may not work as well. Do not take this medication for self-treatment of pain for longer than 10 days, or for a fever that lasts longer than 3 days. In these cases, be sure to consult a doctor, as you may have a more serious condition. Promptly tell your doctor if you develop ringing in the ears or difficulty hearing. If your condition lasts or gets worse, or if you develop new or unusual symptoms, redness/swelling of the painful area, or pain/fever that doesn't go away or worsens, it's important to tell your doctor promptly. If your child experiences an upset stomach or heartburn while taking this medication, it's important to let your doctor or pharmacist know. Your doctor has determined that the benefits of using this medication outweigh the potential risks of side effects. However, it's important to be aware of any serious side effects, such as severe nausea or vomiting, easy bruising or bleeding, difficulty hearing, signs of kidney problems, unexplained tiredness, dizziness, dark urine, or yellowing of the eyes or skin. This medication may rarely cause serious bleeding, so it's crucial to seek medical help right away if you experience severe abdominal pain, black or tarry stools, vomit that looks like coffee grounds, trouble speaking, weakness on one side of the body, sudden vision changes, or a sudden severe headache. While a serious allergic reaction to this drug is rare, seek immediate medical help if you experience symptoms such as fever, swollen lymph nodes, rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. If you notice any other effects not listed here, be sure to contact your doctor or pharmacist. Before giving children's aspirin tablet, Chewable, to your child, make sure to talk to your doctor or pharmacist if they have any allergies, bleeding disorders, kidney or liver disease, stomach problems, asthma, nasal polyps, gout, or enzyme deficiencies. Also, limit alcohol and tobacco use, especially when combined with this product, as it may increase the risk of stomach bleeding. It's important to note that children and teenagers under 18 years old should not take aspirin if they have chickenpox, flu, an undiagnosed illness, or if they have recently received a vaccine, as it may increase the risk of Reye syndrome. If you notice changes in behavior with nausea and vomiting, contact your doctor right away, as this may be an early sign of Reye syndrome. For older adults, they may be more sensitive to the side effects of this drug, especially stomach/intestinal bleeding and ulcers. During pregnancy, only use this medication if clearly needed, and it's not recommended for treating pain or fever. However, in some cases, low-dose aspirin may be used to prevent certain conditions. If you are breastfeeding, consult your doctor before using this drug, as it may harm the nursing infant in large amounts. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with children's aspirin tablet, chewable include acetazolamide, other blood thinners like warfarin and heparin, corticosteroids, herbal medications like ginkgo biloba, and certain vaccines. Before using children's aspirin tablet, chewable, consult your doctor if you have recently received certain live vaccines. It's also important to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers known as NSAIDs. To prevent an overdose of aspirin, read the labels carefully before taking other pain relievers or cold products to make sure they do not contain aspirin. Daily use of NSAIDs like ibuprofen may decrease aspirin's ability to prevent heart attack or stroke. If you are taking low-dose aspirin for prevention of heart attack or stroke, consult your doctor or pharmacist for more details and to discuss other possible treatments for your pain or fever. Also, be aware that this medication may interfere with certain lab tests, so make sure lab personnel and all your doctors know you use this drug. If someone has taken too much children's aspirin tablet and is experiencing severe symptoms such as passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include burning pain in the throat or stomach, confusion, changes in mental/mood, fainting, weakness, ringing in the ears, fever, rapid breathing, changes in urine output, seizures, or loss of consciousness. If your child is taking this medication regularly or in high doses, their doctor may want them to have some medical tests, such as liver/kidney function, blood count, and salicylate level tests. It's important to keep all medical and lab appointments. If you have any questions, talk to your child's doctor. There are many different aspirin products available for children. Some have special coatings and some are long-acting. Ask your child's doctor or pharmacist to recommend the best product for your child. If your doctor has prescribed this medication for you to take regularly, make sure to take it as directed. If you happen to miss a dose, take it as soon as you remember. However, if it's close to the time for your next dose, just skip the missed one and take the next dose at the regular time. Don't take a double dose to make up for the missed one. When it comes to storing children's aspirin tablet, chewable, it's important to keep it at room temperature and away from moisture and light. Different brands may have different storage needs, so be sure to check the product package for specific instructions or ask your pharmacist for guidance. It's also important to keep this medication away from children and pets. When it comes to getting rid of this medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. It's best to consult your pharmacist or local waste disposal company for the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.